One of my dad's beliefs about the foundation's work was it was really important to find the intersection of passion and competence. Finding people who were passionate about what they were doing, but also knew how to get stuff done. I'm David Jones Jr. I'm a board member of the Humana Foundation, also a member of the board of directors of Humana, Inc., and my father founded both the company and the foundation. So I have been around this organization since I was about 3 years old. In 1981, my dad formed the foundation. The co-founders, my dad and Wendell Cherry, were both very interested in the community of Louisville. They, from the beginning, were looking to help the city improve. The core notion in the beginning was for the foundation to have a kind of a structural purpose. In good years, the company would be able to set aside money, and in lean years, the foundation would have money so that steady benefit to community organizations, to arts organizations, could continue. The first really enduring work that it did was getting behind what became the Humana Festival of New American Plays. There wasn't any single place where new plays by American writers were performed. That, through today, is the longest running single corporate support for the arts in America. The physical infrastructure of Louisville, Dad loved real estate, he loved building nursing homes and hospitals. Those physical projects, Waterfront Park, the Big Four Bridge, he loved all that infrastructure. He loved the blossoming of the city. In the early 90s, President Bush called my dad and he said, "We need help. The Berlin Wall has fallen and the healthcare systems in these former Soviet Empire countries are pathetic. They're crushed. Would you go over and look at it and recommend what to do?" When the president asks you to do something, the only answer is yes. And then you have to figure out exactly what that will require.
We offered this cadre of American volunteer nurses and doctors, technology experts, public health experts, to share what they knew and to help them address some of those needs. And I believe that is a great example of the beginnings of the foundation's priority on health equity. Health equity is that good quality health is available to everyone. Really looks at what's called the social determinants of health, things like poverty and poor housing and poor nutrition, lack of quality education, and observes and studies how those elements affect our health. And in the case of the foundation, we embraced the opportunity to learn more about how could we help understand those problems with them more meaningfully, and what could we do together to find solutions. A key priority of the Humana Foundation from the beginning was a focus on education. There were many transformative projects that we were privileged to be part of.
When I think about health equity, it is reaching a place where every single person in our country, and honestly in our world, has the opportunity to achieve their full health potential. 80% of your life and your health potential is predicted by things that are unrelated to actually healthcare or medical care. Or I'm a family doctor, so like being in my office, seeing me as a patient, that has very little to do with your healthcare. The rest is really all these other things: your social needs, your mental health, your behavioral health, your spiritual health, your relationships with your family, your community, your genetics. Those things make up so much more of your health than anything else that you do in the hospital or in the clinics. When I talk about getting to an ideal of health equity, it's when you're looking at someone holistically in the context of all the different dimensions of their life. And to do that, that means we remove any barriers to full health. And those are things that have historically marginalized or disenfranchised or made communities vulnerable, things like poverty or low socioeconomic status, or educational immobility, or racism or oppression. So it's really removing all those barriers to the best health and giving everybody a chance to excel. The Humana Foundation, it's always had health equity kind of as a subtext. It may not necessarily have been what we have said, we are focusing on this, but now with an actual dedicated strategic vision and some pillars created around health equity specifically, we're like elevating that work a lot more. It allows us to find the partners who are working in this space and reach out to them. It allows us to redefine what does all of our work that's happened over the last 40 years, how does that change because we've had a pandemic that we've lived in, and now we have to really rethink of what is health equity now in this context. One thing we saw with the pandemic was that if you have a system where people are disenfranchised and their communities have been made vulnerable, and you bring a global pandemic, you will worsen every single thing that they've had. When we look at the future and the next 40 years of the Humana Foundation, we will definitely focus on health equity and making sure that the communities that we are serving are uplifted as a whole. And I think that's tougher work, because it's one thing to kind of focus on the health of a few, but when you're thinking about kind of uplifting the health of many, that requires really new and creative ways of thinking. How do we work with cities and towns and urban centers, rural centers across the country in making places good places to live? And we could say, like, if you're in a city that the Humana Foundation has touched, we expect you to live long, we expect you to live a healthy life, we expect you to live a full life, we expect you, if you have children or grandchildren, to see them grow up, because we have made so much about the community around you a better place to be. And I think that's where we're gonna thrive in the next 40 years.
We are extremely excited about the work we're doing with the Humana Foundation these days. We've decided that we're going to focus on health equity, which is making sure that health is accessible to everyone. Most importantly, we've decided to focus in our work, and we're going to focus on shaping a healthier approach to nutrition and creating healthy emotional connections. It's an exciting time for the Foundation as we look at ways to collaborate with Humana Inc. and to make a difference in communities all across the country.